For the purpose of the video, I would just like to state that my patient is a reliable source, where in real time we wouldn't be assessing that until the end of the exam.
I'm ready.
Hi, Mrs. Merlo.
Hi.
I'm Jessica. I'm the nurse practitioner that's going to be
Jessica.
working with you today. All right, so Mrs. Merlo, you identify as an 84-year-old white female?
Yes,
Excellent. And what brings you into the office
just
today?
a regular checkup.
Wonderful. And how are you feeling about your health overall?
I'm feeling just fine.
Just fine. Excellent. No current concerns?
None.
Alrighty. Any sort of daily activities that you do to maintain that good
I
health?
do. I do a little walking. I do my own housework. I do puttering in the garden.
Excellent. How often would you say you walk?
Try to walk every day.
Good. That's excellent. Alrighty. How about your dietary habits? Any concerns there?
I think I eat healthy.
Good. Lots of fruits and vegetables.
Yeah, chicken and fish.
Good. You get a lot of protein.
I eat a lot of pasta.
A lot of pasta. How many days a week would you say you eat
About
pasta?
3.
Okay. Have you ever had any problems with high blood sugars in the past?
I've had high cholesterol,
High cholesterol.
which I take Simvastatin.
Okay. When was the last time you had those levels checked?
Last April.
Last April? Okay. So you're not due to have those checked for another month or so. Usually we do those every 3-4 months, but we'll take a look at those, okay?
Yeah.
All right. Any current stressors going on?
No
No stress?
stress. I'm fine. I take sertraline 100.
All right. How about your sleeping patterns?
My sleeping pattern is not as good as it used to be.
Okay. How many hours would you say you get a night?
Around 6.
6? Okay. Do you wake up feeling rested?
Yes. I'm never tired.
Good.
And I don't nap either.
No naps? Do you have trouble falling asleep?
A little bit.
Okay.
Takes me a long time, let's say, to fall asleep.
It does. Okay.
Like I can't just lie down in bed and go to sleep.
Do you feel like you just have too much energy? You're thinking about too much?
It's just, I don't know.
Okay. Are you concerned with that at all?
Not at all.
No? Okay. Once you do fall asleep, do you stay
I'm
asleep?
fine, yes.
Excellent. All right. Now you mentioned you didn't really have too many stressors going on. What types of coping mechanisms do you have in the cases which stressors do develop?
To relax.
Yeah, what do you do?
I knit. I knit, crochet, I read.
Wonderful. All right. Okay, that's great. So now I would just like to get some information about your past health history. Sort of paints a better picture for us here, okay? All right. Now you mentioned that you were taking a couple medications. Do you have a medication list on you that
Yes.
we could review?
I do.
Okay. And while you're grabbing that for me.
I take aspirin.
You do? Okay.
I take calcium and 600D.
Excellent.
I told you about Simvastatin, right? That's 20.
Okay.
I take levothyroxine, 25 for my thyroid.
Okay.
It's underactive.
All right.
I take 100 sertraline,
Okay.
lisinopril, and hydrochloride for my high blood pressure.
Okay, the hydrochlorothiazide.
25, and the other one is only 10.
Okay. And you take those every day?
Every morning.
Every morning. Okay. You're good about taking them? You never forget them?
No, I don't.
Okay. Excellent. And I did just want to get some information from you before, where we were just talking about daily lifestyle stuff. I meant to ask you, any sort of drinking?
I do. I have a cocktail at night every every night usually.
Okay. No family history of substance abuse?
No alcoholism.
Okay. And you don't ever feel like you have to have the drink?
No.
Good. How about smoking?
No, I
No?
don't smoke.
Have you ever
I
smoked
never
in the
did,
past?
no.
Excellent. All right. Any other alcohol, or excuse me, any other drugs or substance use?
I like wine.
You like wine?
Wine.
Okay. But nothing aside from the alcohol? Okay. Now, with the medications, anything over the counter other than the aspirin and the vitamin supplements?
No.
Okay, great. And how about allergies? No?
No problem.
No, none to med, food, seasonal?
Yeah, probably seasonal with a runny nose, a wet nose,
Okay.
a little sneezing.
And that's only during the allergy seasons? This year's been a pretty tough one for a
Yes.
lot of people. Yeah. Okay. Do you take anything for that?
No.
All right. How about chronic illnesses other than the ones that you're taking those medications
Chronic.
for?
Chronic osteoporosis
Okay.
in my right hip.
Right hip. When were you diagnosed with that?
Oh, good 15 years ago with the bone density test.
And have you had follow-up bone density
Yeah, I've had
scans?
2.
And
No
they've been
change,
no
yeah.
changes. Good. Excellent. No other chronic illnesses? No. Okay. How about childhood illnesses?
Yeah, I know I've had
Okay.
measles, the mumps, and the chicken pox, but I can't remember having them
That's
or when I had them.
okay. Now you mentioned the chicken pox. So where you have the chicken pox, you are at risk for the shingles.
I've had the shingles
You have.
on
Okay.
my back, across my back.
Okay. Do you remember what year that was in?
That was in the 90s.
Now, have you received a Zostavax or the shingles vaccine? No. Okay. So we do recommend it, although you did have it, you have a less likely chance, but you may very well again be. Let me check something here. That is something that you could possibly get in the future again. So if you haven't received that vaccine, we do recommend everyone over age 65 receive 1 dose of that. And it does last for a lifetime. So if that's something you're interested in doing, I would like to get you that today.
Okay.
Great. And your other vaccines, the pneumonia and
Yeah.
tetanus, up
I'm
to
caught
date?
up.
Good.
Yeah.
How about a flu shot?
Flu shot I take every October.
Wonderful. All right. Much better than the flu, huh?
Oh, yes.
All right. How about accidents or trauma?
Accident. I had compression fracture on my spine.
When was
And
that?
That was, oh goodness, good 10 years now.
No trouble since then
No,
with your back?
it's
Good.
much better. No pain, nothing.
Good.
And I fell and fractured my ankle in 3 places, and I have a plate and some hardware.
You do? Okay. Does it ever bother you at all?
No,
No trouble with range of motion, no pain,
Nothing.
swelling? Good, good. All right. Were you hospitalized for the ankle?
and I was there for 4 days.
Okay. Any other hospitalizations?
Just when I had my baby.
Okay. So you had, and how old were you when you had
I was 32.
32? Just one child?
1 child, C-section.
C-section, okay. Ever have any complications from the C-section? All right. Any other miscarriages or abortions?
None.
No? Okay. And how old were you when you began your period?
In the 8th grade.
8th grade?
And I had it until I was 62 or 63.
Okay, so you started menopause around then, is that correct? On 62?
No, I think I started before 62, but I didn't start until after I had a DNC.
You had a DNC, okay. Ever have any complications from that?
No,
No cramping, no abnormal?
nothing.
Excellent. All right. And then I just noted here your last physical that you had about a year ago. You mentioned that that's where you were diagnosed with the hypothyroid?
Yes.
Okay. And that's been okay since?
Okay.
How about the rest of that? Any abnormal results from that visit?
No.
No. Excellent. I like to see it coming in every year. That's important. Alrighty. And then how about your family history? I'd like to get a little information about them. And I'm just gonna grab a piece of paper here and draw a little chart for my own benefit, okay?
Okay.
Any siblings?
3 girls.
3 girls, all girls, huh?
3 sisters.
And ages for them?
82, 80, and 79.
Are they all alive?
They are.
Any significant health issues with them? Diabetes, heart, anything?
No, they're fine now, but they've had, my youngest sister had a ruptured colon.
Okay.
And she's not wearing the bag anymore. They reversed it.
Good.
And this 82-year-old has skin cancer.
Skin cancer? Okay. That's current?
Yeah.
Okay. And you did say they're all alive? Okay. You mentioned you had 1 daughter. How is her health?
Miami's fine.
Good. And any grandchildren?
I have 3 beautiful granddaughters.
All girls there too, huh?
Who are healthy and well.
Good. And how about your parents? Are they both deceased?
Yeah. My mother died at 69 with a coronary in her sleep.
Okay.
My daddy died at 75.
And what was his
With-
cause of death?
They said he had liver cancer,
Liver.
but he had like 3 heart attacks.
Okay. So the coronary seems to run in the family.
Yes.
Any other significant health issues with them? Diabetes?
No.
Strokes?
No.
Okay. How about your grandparents on both sides?
Both sides. On my mother and my mother's mother and my mother's father both had heart attacks.
Okay.
My grandfather was 75. My grandmother was 69.
Okay.
And my daddy's, I just knew my grandmother because his father died when he was young.
Okay. So you never had a chance.
And I think she died suddenly too in her 70s.
Do you know what her cause of death was?
What must have been a heart attack.
Okay. Do you know how old your paternal grandfather was when he passed away?
No.
No. Okay.
I don't know.
That's fine. Okay. Excellent. Thank you very much for that information. So it looks like other than 1 sibling and your father's liver cancer, there's no other cancer in the family. Is
No,
that
there
correct?
isn't, no.
Okay. All right. Excellent. Thank you very much for that. All right. And then back to a little bit more about you. So you did mention you have 1 daughter. Do you have a partner?
I do. A male.
A male. And is he still alive?
He is.
Excellent. And does he live, do you live together?
Yes, we do.
And where is home for you?
Home in Amy's home.
And that's your
But my
daughter?
own apartment.
Okay, an in-law apartment, excellent.
In-law apartment.
And you feel comfortable and safe there?
I'm very happy and content.
Good. Do you feel like if you ever had any concerns, you could approach your daughter?
Absolutely.
Good. Do you feel like overall you have a strong family and social support system?
I do.
Awesome. How about work? Do you currently work at all?
Not currently, no.
No. Are you retired?
Yeah, I am.
What type of work did you used to do?
Oh, in my younger days, I was a secretary.
Okay.
And then I worked in my 70s over here in a flower shop.
Oh, excellent.
Couple of days a week.
And do you miss that?
I miss that. I miss my girls, but we go out to dinner now and then.
Okay. You're able to stay in touch with them?
I do.
Oh, that's very important. I like to hear that. All right. How about driving? Do you drive at all?
No, I gave that up.
Okay. All right.
I don't want to drive anymore.
All right. I don't want to drive either.
I know. But my grandbabies drive me.
Good. Then you're very fortunate. All right. How about finances? Do you feel stable? No
I'm
concerns
stable.
there?
No.
Okay. All right. And how about sexual activity? I like to ask all my patients that, get some information there.
No, I haven't had that for a long while.
Okay. Do you have any concerns, or is that just
No,
by choice?
By choice.
Okay. Alrighty. Excellent. Thank you so much. All right. Okay, Mrs. Merlo. So what I wanted to do now before we go ahead and do the physical exam, I just wanted to do a quick run through of the general head to toe and get some information, okay? All right. So have you any concerns as far as fatigue, general aches and pains,
No.
weakness?
No.
How about fevers?
No.
No? Excellent. Okay. No changes in weight, gain, or loss?
None.
Awesome. How about with skin, hair, and nails? Any sort of abnormalities that you're concerned with?
I've had a few lesions removed.
Okay, nothing ever cancerous?
No.
Excellent. All right. Any moles that you monitor that have changed at all? No? Okay. Any lumps or bumps on the skin or anything?
Yeah, I have a lot of tags and marks.
Skin tags. Okay, so mostly cosmetic?
Yes.
Okay. Do you see dermatology?
Yes.
Excellent. Alrighty. How about your eyes? Any trouble with seeing? No, I see you wear glasses. How often do you see the eye doctor?
Every couple of years.
Good. No concerns with blurry vision?
None.
No? Alright. No trouble focusing?
No.
No partial vision? You don't see anything floating or anything like that?
No.
Good. Any drainage from the eyes?
No.
Redness?
No.
Swelling? No pain?
No.
Good. That's excellent. How about the ears? You hear okay?
Sort of.
Do you have decreased hearing?
Yes, I do.
In both ears?
No. Mostly in my right ear.
Okay. Do you feel like it gets in the way of daily activity, or
No.
is it minor?
No. Doesn't
Okay.
bother me.
So likely some normal hearing loss that we can see with age, but we'll definitely take a look at your ear when we get you on the exam table, okay? All right. Any drainage from the ear?
No.
Any pain?
No.
Any ringing in the ears?
No.
Do you ever feel off balance at all?
No.
Okay. How about the nose?
No. I know it once.
A little bit of clear runny nose?
Yeah.
You mentioned the environmental allergies.
Yeah.
Is that year round or once in a while?
No. Mostly in the summer.
Okay. All right. Any history of nasal polyps?
No.
No. No bloody noses?
No.
No pain?
No.
No breathing difficulty? Any snoring that you're aware of?
Not that I know of.
All right. And how about with the mouth? Any concerns with the mouth?
No.
No?
Dry mouth.
Dry mouth?
Mostly when I wake up.
It's probably from sleeping with the mouth open at nighttime, do you know?
I don't know.
All right. No bleeding from the gums?
No.
No loose teeth? Any pain? No lesions in the mouth?
No.
Oh. Any trouble with swallowing?
No.
No throat pain?
No.
Good. Any difficulty or changes in your taste?
None.
None. Excellent. Any lumps or bumps on the outside of your throat that you felt at all abnormal?
No.
No? Okay. Any swollen lymph nodes?
Not that I know of.
Okay. We'll check those out for you too today. All right. How about your breathing? Ever have any chest pain, shortness of breath?
None.
Any rapid breathing, shallow breathing? No? And you did say no dizziness, no lightheadedness. Excellent. And no chest pain. Ever have palpitations?
Not that. No. I don't think so.
How about coughs?
Coughs?
Yeah?
Yeah, I get coughs.
How often?
Not too often. I don't get a cold much anymore either. And coughing is mostly in the morning, like when my nose runs.
Okay, so sort of the post-nasal drip
Yeah.
irritation. Okay. Never coughing anything up?
No.
All right. Good. All right. And how about with your breasts? Any abnormalities?
No.
Do you do self-breast exams?
Once in a while.
Okay, so we'll go over that.
I
in the
have a
physical.
mammogram every year.
You do? Excellent. Yeah, you mentioned that. Okay. Great. Any sort of swelling, redness, tenderness? No. Any sort of nipple discharge, nipple pain? Any lesions that you've seen on the breasts? Any lumps that you felt? Any abnormal, almost looking like the skin is what we call dimpling? Anything like that? Good. Excellent. And no swollen lymph nodes that you felt up in the armpit area? Okay. All right. Do you ever have a sensation, like a choking sensation or difficulty with activity? Any burning in the chest ever?
Like a heartburn? Yeah.
Get a little heartburn?
Yeah, sometimes.
Okay.
Depends on if I eat something
All
that
right.
doesn't agree with me.
And it's alleviated with over-the-counter stuff like Tums?
Tums, yeah.
Your Tums? Okay. No actual vomiting or anything?
No.
No current nausea?
No.
Abdominal pain?
No.
Any constipation or diarrhea?
Mm-mm.
Good. Normal bowel patterns? Go once a day? How often?
Usually after breakfast.
After breakfast? Okay. How about your urinary patterns? Are those normal?
I don't know. I go a lot.
Frequency? Any urgency?
And not really urgency, but frequently.
Okay. No lower back pain or side pain?
No.
No blood in the urine? You're not having any increased thirst?
No.
No. Okay. Alrighty. And any sort of vaginal pain or discomfort? Dryness? Discharge?
No.
Okay, excellent. And how about in general, you feel overall good strength-wise? Any weakness of the muscles? No trouble with balance, with walking?
No.
No bone or joint pain?
But just in my fingers.
Finger joints? Okay. Little history of arthritis? Is that relieved with over-the-counter medicine?
I don't take anything for it.
Does it worsen cold weather?
No.
No.
It comes and it goes. Some days it hurts, some days it doesn't.
Okay. No abnormal rashes? No history of any sort of insect bites or anything like that? Good. And then overall, you did mention that you have the history of the anxiety. Have you ever been hospitalized for anxiety
No.
or depression?
No.
Okay. And would you say that you currently feel stable?
I do.
Any senses of helplessness? Have you ever had a history of suicidal thoughts?
No.
And you wake up, would you say you wake up more days feeling happy or sad? Happy. Good. All right, Mrs. Merlo. Well, that is all that I need for you from this. So I'm going to give you a few minutes to go ahead and get dressed into your gown. I'll step out and then I'll be back with you and we'll do the physical exam. Do you have any questions for me?
No.
Any concerns?
No.
All right. Looks good. I'll be back in a few minutes.
Okay.
Thank you.
All right. I'm ready.
All right. Hi, Mrs. Merlo.
Hi.
All right. Thank you so much for getting changed here for me. Well, it looks like we got some results here. They grabbed your height and weight for me and a couple of your vital signs. So I see that you came in at 5 foot 1 inch, 119 pounds. Your respirations were 18. Your temperature was 98.6. And your pulse was 50 beats per minute, okay? So that all looked normal. I just want to take a look at your blood pressure, okay?
Okay.
Excellent. Are you comfortable?
I am.
Thank you very much. And keep that arm nice and relaxed for me, okay?
Mm-hmm.
It's just going to get a little tight on your arm. Perfect. (124/70). Okay. Thank you very much. All right, so Mrs. Merlo, we got most of the information that we needed through that history. So
Yeah.
now I'm just going to run a head-to-toe exam and make sure that everything lines up okay. If you have any questions or concerns, please don't hesitate to stop me, okay? So I'm just going to take a look here at these nails. They look great. And then at the skin. A couple of little sunspots and aging spots, which are normal. Do you have any concerns with your skin at all?
No.
No. Any abnormal moles that you've had to have checked?
Yeah. Not abnormal, no. They
No?
wanted to check the lesions that were there, and I had a couple a cyst removed from here.
Okay. Yeah, I'm just gonna poke around here and take a look. I don't see anything now. How long ago did you have the cyst removed?
Oh, that was quite a while ago. Let me see. Maybe 8 or 9 years ago.
Okay. So you've seen dermatology?
Yes, I've seen them.
Okay. All right. Now if you could take a look at me, raise those eyebrows, give me a big smile. Perfect. Everything looks symmetrical, so that's good. Okay. I took a look at your scalp. I didn't see anything. I'm just going to feel around, okay? And you said the cyst was removed from over here? Okay. Yeah, I don't feel anything, so that's good. All right. Thank you. Now I'm just going to put my hand here and I just ask you to open your mouth nice and wide for me. Close it. One more time. Good. No popping or pain?
I popped once in a while on this side.
Once in a while, no pain or anything?
No.
Never any swelling? Okay, good. All right. So now I'm just going to take a look at your eyes, okay? We can start by doing the external exam, and then I'm going to have you check your vision with your glasses on, okay? So if you could just look right at me here. Excellent. No swelling, no redness, no yellowing of the sclera. The conjunctiva is white, so that's good. No itchiness?
No.
No drainage?
No.
Okay, excellent. All right, so I just want you to look at my finger and follow it for me, okay? Perfect. One more time. Beautiful. And then if you could cover one eye for me. Keep an eye on this finger, and then uncover it and keep looking at my finger. Perfect. And then the other eye. Excellent. And mark up. Beautiful. And then if you could just follow my finger, I'm going to make a big H, okay? With just those eyes.
Mm-hmm.
Perfect. Excellent. Awesome. All right. Now I'm just going to get you to put these glasses on for me. And if you could cover one eye for me and read the smallest letters that you can.
L-E-F-O-P-C-T.
Excellent. And then switch. Same thing.
L-E-F-O-P-C-T.
Excellent. And then with both eyes, the smallest line you can see, reading it backwards, please.
O-E-C-T-L-F-B-P-B-F.
Excellent. So 2015 with your glasses on. That's perfect. Thank you very much. All right. Now I'm just going to dim the lights in here for a moment, okay? And I want you to look straight ahead at me and stare straight at me, okay? Nice and big with the eyes. Beautiful. One more time. Excellent. Once more. Wonderful. Awesome. Now I'm just going to take a look, and I want you to look straight ahead at the big E for me, okay?
Okay.
Alright. I'm a little blinding for a second. Excellent. And I'm going to come around and do the same thing on this side, okay? And then look straight ahead. Awesome. Perfect. Let me turn those lights back up. Now I'm going to take a look at your ears, okay? Your eyes look great. So I'm just taking a peek here. I don't see anything abnormal. No lesions, no drainage, dry skin, redness. Same size. Oh, wonderful. And can you tell me if you can hear this sound? And how about this? No, and that's the side that you said you have a little bit of the decreased hearing. And that's normal with age. Okay, I'm not too concerned about that. You're able to speak to me in a normal volume, so I know that you can hear and can hear yourself speaking to me. Okay? So now I'm just going to take a peek in those ears. All right, up in. Beautiful. Once more. Same thing. look at me. Now I'm going to check out the nose. Looks good. The structure is the same on both sides, so that's good. I'm going to feel around to those sinuses. Take a look at them, okay? I'm going to do a little tapping, okay? Tell me if there's any pain, pressure, or discomfort. Any pain, discomfort?
No.
No? How about when I push? No. Excellent. All right, can you cover one side of your nose? Deep breath in and out. Beautiful. Other side. No problems?
Nope.
Good. So, nice patent airways. We like that. Now I'm just going to lift your nose up and take a peek inside, okay?
Yeah.
All right. A little bit of redness and clear drainage, but that's consistent with those allergies you were telling me about, okay? No
Yeah.
swelling or anything, so that's good. All right. How about that mouth for me? You can look right at me there. No dry lips or anything. Pink, your color is good. Moist, no problems there. No trouble with swallowing.
No.
No pain, sores. All right. I'm going to take a peek inside, okay? Okay. I'm going to push down on your tongue, and I want you to give me a big ah. All right? Stick that tongue out. One more time. Beautiful. Can you stick your tongue out at me? Perfect. And open your mouth nice and wide for me. Poke around here. No redness. The gums look good. You got a few fillings in there. And tongue up, so I can look under the tongue. Beautiful. All right, excellent. That looks great. And you said no sore throats or anything? Okay.
Not recently, no.
All right, excellent. So if you could take a look up for me. I'm just going to take a look. Good, everything looks good. All right, I'm going to take a look here. Just kind of feel around, okay? Awesome. Good, and there's your thyroid. No pain or anything? All right, how about when you swallow? Excellent, and one more time for me. Beautiful. No pain with this? Okay, excellent. All right, so now I'm just going to kind of feel around here on your little lymph nodes, okay? Got about 9 major areas we want to check on. Never have any swelling of them at all?
No, never.
Good. Excellent. Beautiful. I don't feel anything there. And then can you do some, I want you to follow me. Put your ear to your shoulder. Perfect. Come back up one more time. Chin to chest. And look up. And give me a big no. Not moving. Perfect. Any pain or discomfort or stiffness? Can you shrug those shoulders? Beautiful. All right, so now I'm going to take a look at your chest, front and back, okay? I'm going to poke around, take a little listen, okay? All right, let me come around the back here for me. And start by taking a look. We noticed the same little skin lesions before, but nothing else. And if you could just breathe normally for me, okay? Excellent. All right, and I'm just going to pinch a little bit on your lower back, okay? And I want you to take a nice deep breath for me. And let it out. Beautiful. All right. So now I'm going to poke around and do a little bit of
All right.
drums back here, all right?
All right.
Beautiful. Nice and clear. Awesome. And I'm going to listen as well, okay? And I want you to take a couple deep breaths for me in and out through your mouth, okay? Good. Couple more for me. You're doing great. Beautiful. Awesome. Beautiful, excellent. Now I'm just gonna check if you can lean forward for me just a little bit. I'm just gonna bump on the bottom of your back, okay?
Okay.
Quick little bump. Any pain?
Nope.
How about on this side?
Nope.
Good. Sit up for me. All right, now I'm gonna take a look at the front, okay? Scroll this down just a little bit and keep yourself covered. And deep breath again for me. Beautiful. Do you have no shortness of breath or anything ever? Okay. Breathe normally for me. Awesome. Good. Excellent. All right, and I'm going to bang around again, okay? Beautiful. I'm going to listen to the upper half and then we'll do the lower half, okay? Breathe normally for me, okay? And deep breath. In and out through the mouth for me. Good. Good. Beautiful. And one more. Beautiful. Okay, so I'm going to lie you back so I can listen to the bottom half, okay? Okay. I'm going to grab an extra Johnny to cover you while we lay you back. All right, you ready? Going down.
All right.
All right, put it down for me. All right, I'm gonna roll this one up, okay?
Yep.
Right under your breast for me. Perfect. All right, so I'm gonna feel around again, okay? Beautiful. Awesome. All right, now I'm gonna do the same thing here, okay? Good. Beautiful. Good. Excellent. And I'm gonna just take a listen. Put this out for your legs so they're not dangling off the table. There you go. All right. And just breathe normally, okay?
Okay.
Excellent. All right. Excellent, thank you. So I'm gonna sit you up just a little bit. So for this part of the exam, we're not gonna actually go ahead and do it, but this is where we would do our breast exam. So we would start by inspecting in 3 different positions. You have your hands up in the air, hands on your waist, and then I have you bend forward for me, okay? Then we're gonna inspect the breast, make sure that there is no abnormal pinching of the skin, no discoloration, no lesions. We're going to express the nipples, make sure there's no discharge, palpate for lumps. We'll do the breast exam in the up and down ladder vertical pattern. Make sure there's no pain or any sort of concerns there. And then Mrs. Marlowe, are you doing self-breast exams at home?
Once a while.
How often would you say you're doing them?
Not very often.
Not very often. We do recommend that you do them once a month. When was your last mammogram?
I have one every year.
Every year? When was your last one?
April.
And how were the results of that?
Nothing abnormal.
Okay. And I did note on your history that you were a little bit older when you had your daughter. You went into a late menopause and you started your menstrual cycle a little bit early.
Yeah.
Because of that, you know, we do consider that a little bit of a higher risk for development of the breast cancer. So I am glad that you do the mammograms yearly and we screen and monitor for that. That's important. Okay.
Okay.
So that's what we would cover there. All right. Do you have any questions about that for me?
No.
All right. So now while I have you laying down, I'm going to take a look here at your neck. Take a look at those major arteries, which are pumping great. I can see them. All right. Kind of feel beautiful. Awesome. Okay, I'm going to take a listen, okay? Excuse me. They're lighted. Awesome. And I'm just going to roll this up so I can take a look here at your chest. I'm going to use some lighting, okay? Beautiful. This is great. Awesome. I'm just going to take a listen, okay?
Okay.
I'm going to actually have you roll a little bit to the left for me if you're able to. This is the best way to hear what we call the PMI, okay? Beautiful. Nice and strong. See if I can. Excellent. All right. I'm going to roll that down. You can roll back onto you. All right, so now I'm going to take a look at your belly, okay?
Okay.
All right, I'm going to roll these little arrows down to your waistline here. Excellent. All right, so I'm going to take a look. I don't see abnormal protrusions, no swelling or anything like that, okay? All right, and then I'm just going to take a listen as well. Beautiful. Good. Excellent. Gotta find your liver over here. All right, excellent. So now I'm just gonna feel around lightly, okay? Any pain or tenderness? No. Good. Now I'm going to push a little bit harder, okay? Try to see if I can feel your liver. Can you take a deep breath in and out for me? Beautiful. Awesome. Excellent. Thank you. And I'm just going to come down here to your inner thigh, okay? I'm going to feel here for your femoral pulse. Beautiful. No swollen lymph nodes either. That's great. And if you could raise this hand up above your head for me and give me a big cough. Beautiful. I'm going to check the other side, okay? You can bring that arm back down. Excellent. All right, I'm going to do the same on this side, okay? Yep. Awesome. And no swollen lymph nodes. That's good. And then arm up for me. And a nice cough. Excellent. Thank you very much. All right. I'm going to roll this down here. Now while I have you down, before I sit you up here, I'm going to just kind of push your ankles up and down for me. Check out these joints. Excellent. And can you push down on me? Beautiful. And don't let me pull. Can you pull back? Flex your feet up for me, toes to the sky. Yep, perfect. Beautiful. I'm just going to bend your knee. Any pain or discomfort with that? No?
No.
Beautiful. And can you try to pull your heel down. Don't let me pull up. Beautiful. And then this side for me. And bend. Straighten. Excellent. Any pain or discomfort? No? And then don't let me pull up. Beautiful. All right. So now I'm going to sit you up, okay?
Okay.
Is that comfortable? Yeah. Now you want to scoot back for me? The only thing I would like to know is normally when I do the abdominal exam, I want to make sure that I put you all the way down and not leave you up at a little bit of an angle. So that is something that I would fix for the future. All right. So now you're looking at me. Can you squeeze my fingers for me? Beautiful. And straighten them out like this. No pain. A little bit of swelling. You can see a little arthritis.
A little
But
pain there.
all right. Do you ever take anything for it?
No.
Okay. How about up and down? Beautiful. And like you're lifting weights for me. And you showed me before you can do the muscles and then down. And then try to pull. Don't let me pull down. I'm going to push. I want you to go like this. Yep. Beautiful. And now the opposite way.
Down.
Excellent. Once more. Pull.
Up.
Beautiful. Down. And then with the head, don't let me turn your face. Beautiful. This way. Excellent. Perfect. All right. Now I just want to check all your reflexes, okay?
Okay.
Sit back for me. Before we do that, I'm just going to check the rest of your pulses. We already got the radial when we got your blood pressure at the beginning. That's what they had measured. We also checked under here for that apical pulse, and I'm going to check the rest, okay?
Yeah.
So I'm going to do the ulnar. Beautiful. And we also got your femoral as well. This is the brachial. Excellent. Perfect. All right, now I'm going to come back here. I'm going to check the back of your knees, okay? Wonderful. Awesome. Come down here on the top of your feet. Beautiful. Excellent. Perfect. You got great pulses. I'll just check on this side as well. Wonderful. And in here. Excellent. All right. All right, so we're getting to the final part of our exam here. I'm just going to do a couple things. I want you to tell me if what you feel is a sharp or dull pain, okay?
Dull. Dull.
Can you feel that?
Yeah.
You can, okay. And tell me where this is. Which leg?
My right leg.
How about this one?
Yeah.
Which leg?
Left leg.
How about this one?
Left leg. Left. Right.
Good. And then over here. Tell me which arm. Can you feel that?
Yeah.
Can you feel this?
Right. Yeah.
And then, can you feel this?
Yes.
Or from this? And then up here? Can you feel that?
Yeah.
Feel that?
I do.
And that?
Yeah.
Feel this?
Yes.
Sharp or dull?
Sharp. Sharp. Sharp.
All right, so you have both the light and the sharp. Wonderful. All right, so now we're going to check your reflexes, okay? So we're going to go through here, and I'm just going to have you start by resting your arm nice and soft for me. Perfect, just like that. Hand on your waist. This is the first one. A couple quick strikes here, okay?
Yeah.
Beautiful. Nice and strong. That's awesome. All right, we're going to come around the back. I'm just going to hold your hand here. I'm going to hit right back here, okay?
Okay.
Perfect. Excellent. And I'm going to come down here. I just need you to keep your hand out a little bit for me. And it's going to be just like I'm taking a pulse, okay? Quick little push here. Beautiful. You have great reflexes. All right, I'm going to do the same thing here, okay? Nice and relaxed for me. Awesome. Great. Rest easy here for me. Just okay. Beautiful. And this one, just rest it here. Excellent. Good. All right, now we're going to just check your knee, okay?
Mm-hmm.
Beautiful. And then this side. Excellent. All right, now I'm going to come down here. I just want you to keep your foot as relaxed as you can for me, okay? And I'm going to flex it up like this, but I want you to keep it relaxed. Excellent. And then this one, same thing. Keep this foot nice and relaxed. Flex it up for me. No pain or anything. Good. Beautiful. Perfect. Thank you very much. All right. So those are your reflexes. You did great on that part. Now I'm going to start. I'm going to actually just check sort of all your general muscles here. Make sure everything, we kind of went over it in general. I was assessing the whole time. Muscles are the same, good tone. We checked, we did some strength exercises already, so that looked good. This is good with the legs. Both the legs, there's no, where you had this surgery, sometimes you can see a little bit of atrophy, where the muscle you're not using can get a little smaller and weaker, but it looks like you've got equal strength back, so that's great. Okay. Now I'm going to have you hop down for me. Nice and easy. And now I'm going to have you face me.
Can I put my glasses back on?
Absolutely. Before we do anything else, can you put those hands on your hips for me? And I want you to show me if you can go side to side. Beautiful. And a little forward, sort of towards me. Excellent. Lean back a little bit. Excellent. All right. Now I'm going to have you walk to the corner, normal, back and forth for me, okay? Excellent. Come on back. Wonderful. And then one more time, a little bit of heel to toe for me, okay?
Okay. It's what I can't do.
That's okay. And then turn around. And one more time. Beautiful. All right. And then the last thing I'm going to have you do is face me. Stand with your feet planted together firmly. Palms up like this. Straight out in front of you. Beautiful. And then close those eyes. And we would go ahead and do this Romberg for 30 seconds to make sure that there was no falling and there was no supination. We have none going on. All right. Excellent. And take a seat back up here for me, Mrs. Merlo. That was excellent. Beautiful. Whoop! You all right?
I didn't have my cocktail yet.
All right. So, Mrs. Merlo, that's everything. It looked
Okay.
great. Do you have any questions or concerns
No.
for me?
Except I've never had a better physical.
Oh, well, I'm glad that I could do that for you. Thank you very much. So if you have any questions, you can certainly get in touch at any time. You sure there's nothing else I can help you with today?
I'm fine.
All right. Then you're all set. You had a great physical, and we'll see you next year.
Thank you.
Thank you very much. You can take your time getting undressed, okay?
All right.
Thank you.